The Medicare Diabetes Prevention Program is a wonderful program that offers support and resources to help patients that are at higher risk for developing diabetes to prevent progression to actual diabetes.
The Medicare Diabetes Prevention Program is a 52-week program designed to change lifestyle behaviors, primarily diet changes, exercise, as well as stress management. So we address all of those issues together as a group to promote small progressive changes to bring about big changes, big results in the end. With type 2, there's a period of prediabetes for often 10 to 15 years. So if someone's going to the doctor regularly and getting that A1C measured, your doctor knows if it's starting to creep up, and making changes early can turn that A1C around.
We have two goals for our participants. We want them to achieve at least a 5 to 7% weight loss over the program, and then also to increase their activity to at least 150 minutes per week of a moderate intensity exercise. So we meet frequently during the first half of the program, every week or every couple of weeks, and then maybe once a month during the last 6 months.
And that group dynamic is what really makes the difference. It's the secret sauce.
People can kind of share their experiences and what's worked for them and challenges they've faced.
We're looking for lifestyle changes, diet, exercise changes. It sounds simple, but putting it into practice is much more difficult. So the advantage of being in a group is that you learn from other people who are in the same situation as you.
I think it can really help other people to see, this worked for this person, so maybe this could work for me.
Patients often want more from us, right? They see us for a quick 15 or 20-minute visit, but they're always left wishing that we could just ask a few more questions. We had a little bit more time. And so allowing patients to engage with this type of program where they have hour-long sessions where they're meeting weekly for 6 months, and then 6 months of monthly follow-up, as well as having interaction and engagement with other peers in this program, is a huge selling point.
We've seen a lot of good come from the program, and a lot of people who are, really able to make these lifestyle changes and stick with it and make good progress. We have 15 regular participants in our group right now, and we've seen a total weight loss over our group of over 175 pounds. And that's an average weight loss per person of about 5.5%.
Our most successful patient has lost 16% of her body weight. That was over 30 pounds.
I have had a patient that was very successful in completing this program. Thus far, since starting the program, her A1C decreased from 6.3% to 5.9%, which is a huge reduction. She's also lost greater than 5% of her body weight. I think what has helped my patient to continue to stay engaged is that she was seeing the progress. When she returned to our lab to have her blood redrawn, she saw her A1C drop right before her eyes in a matter of 6 months. For the first time, she actually felt empowered to be able to make significant change that is actually changing her health. I would encourage other providers to really take that passionate approach to explaining to their patients the risk of where they are and about how we now have this resource and tool to hopefully keep you from crossing over the threshold to developing type 2 diabetes.
We do, try to send out information to all of our providers that this program is here, it exists, and, we want you to send your patients to it. Your patients trust you. So if you tell them, I think you'd really benefit from this program, then I think patients are going to listen to that and want to be a part of it.
That encouragement from a physician to join the program is vital. It takes me a lot of time to reach out and find patients who are eligible for this program. I would love it if I just had people reaching out to me saying, hey, my doctor told me I'm eligible for this program. When is your next program starting? This experience leading the diabetes prevention program has been extremely rewarding for me. I have type 1 diabetes. I was never given the opportunity to prevent diabetes, so I feel just I feel really lucky to be able to help people prevent it.
We know that patients with prediabetes often go on to develop diabetes and the long-term impact that that can have on their health. So if there's a very robust evidence-based program that's currently in place that can provide resources and tools for patients to decrease their risk, we should definitely take full advantage of that. When I encounter patients that seem a little bit hesitant or resistant to receive preventative health services, I almost always accept it as a not right now and I'll try again later. So I learn as much about their no's as possible, and then I can use them as a problem-solving tool in the future when I offer that service again. But a no is not a no to me, it is a not right now.